Healthcare workers are now on Ottawa to put emergency measures in place to protect frontline staff in the face of this global pandemic. Joining me now is Linda Silas, president of the Canadian Federation of Nurses Unions. Thanks for joining us this morning. Linda, we spoke with you last month, and at that time you were urging the government for more supplies for nurses, including respirators. So what has happened since that time?
Well, we've met with the Public Health Agency of Canada, all healthcare unions in Canada. That meeting was last Friday, and we're having another meeting today at noon with them again. What has happened is everything has speed up. As you know, the cases are climbing up. We're having more cases hospitalized, more testing units, but we're still very slow in making process of getting the proper personal protective equipment for healthcare workers and nurses.
Have you seen an increase in supplies for you?
The supplies are there. It's just the rules around who can use it and in what circumstance can we use them. And that's the key issue we're looking at. You know, I look at statistics around the world, and 13% of patients are going to be hospitalized. I just got a report yesterday from the International Council of Nurses, and in Italy, 9% of healthcare workers got sick. When you think of 9% of healthcare workers got sick, and then they go home for 14 days if they're lucky and they don't get critically sick, that's a big resources out of the hospitals or a healthcare sector. So we do not understand why government are not listening to the proper occupational health and safety and providing training, but for contact, droplets, and airborne protection.
Now, you wrote a letter, Linda, to Prime Minister Justin Trudeau calling on Ottawa to enact emergency measures. So how would that help?
Well, it's the same thing for emergency measures for the general public. You have to realize that the government's doing an amazing job in protecting the public. Look at us right now. I'm holding my iPhone in my office by myself to do an interview with you. You know, we're all doing the same thing. Well, not the same thing, but we're doing what we can to protect each other. You know, the best saying, think that you have the virus and you do not want to protect your contaminate your neighbors. But when we come to healthcare, there's this debate between the scientists and those who are doing the job. And that is insulting. You know, I believe in science, and all our position papers and our stands are science-based. But it comes to the point that we have to respect those who are there on the front line. They need to use their professional judgment and do their own risk assessment. And I'm sorry, if a nurse, if a doctor, if a healthcare worker asks for an N95 respirator, they should get it to protect themselves so they can protect their coworkers and their families. And that's our line in the sand, and that's what we will be telling the Public Health Agency of Canada again today.
Linda Silas, we appreciate your time. Thank you so much for joining us this morning. And a reminder to Canadians, we've been telling you all morning, tonight at 7:30 local time, wherever you are, head out on your front porch. You can sing, play an instrument, clap your hands, whatever you can do to say thank you to all of our frontline workers.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.